everyone, let's discuss about APGAR Scale, a quick assessment tool that is used by healthcare professionals to assess where the newborn is healthy or need any medical attention. Having 5 different components, the APGAR Scale itself explaining about these components, where A stands for the appearance of the baby, the P stands for pulse, G stands for grimace. Grimace is about the reflex irritability, and here A stands for activity of the muscle. That means here we are going to assess the muscle tone, and the R stands for respiration. The score is 0, 1, 2 according to the response we are getting from the newborn or the appearance of the newborn. Okay, now have a look in the scoring system I'm providing on the screen. Here you can see the appearance. That means the skin color. The skin color of the baby is bluish green. You have to mark as 0. And if the color is normal all over the skin, but the extremities are blue, you will mark as 1. If the all over the body the color is normal, the extremities are pink, you have to mark as 2. Okay, next is the pulse. Pulse is normal heart rate. If there is no pulse, it will mark as 0. If the pulse is less than 100 beat per minute, will mark as 1. And if the pulse is normal, that is more than 100 beat per minute, will mark as 2. Next is the grimace, that is the reflex irritability. If the newborn did not show any kind of response to your stimulation, you have to mark them 0. And if they show any simply facial expressions, you have to mark them 1. And if the newborn show a proper response to your stimulation, that means they sneeze, cry, cough, pull away, that will be marked as 2. Next is the activity, which basically measures the muscle tone. And if the newborn did not show any kind of activity, the muscles are floppy, you will mark as 0. And if the newborn extremities are in flex position and there is little movement, you will mark the newborn as 1. And if there is a strong, active, spontaneous movements, you will mark the newborn as 2. The last component is respiration, which is actually the breathing and the effort of the newborn. If the newborn did not breathe at all, there is no breathing, there is absence of breathing, you will mark as 0. And if the newborn is breathed but there is a slow rate of breathing and there is weak cry, that will be marked as 1. And if the newborn have normal breathing, they vigorously cry and actively breathe, that means you have to mark them 2. Is that clear? Next is the scoring. As we already discussed, there are 5 different components and 2 is the maximum score for each component. So the total score can be 10, the maximum total score. So the score is anywhere between 0 to 10. So the 10 is the maximum score, which is absolutely normal, and this is very rare to get in any babies because the bluish discoloration of the extremities are always there. This is very rare to get 10. So 9 is also normal. 7, 8, 9 considered to be the normal score, and it is healthier for the baby. And if the score is between 8 or you can simply say 6 to 8, the baby need a little assistance. And if the score below 5, the baby need immediate medical attention. Okay, if any newborn gets 0 score for more than 10 minutes, the resuscitative effort should be suspended. It is very severe and it can be fatal. Next is the contraindication or limitation. So there is no as such contraindication of APGAR score, but there is some limitation. That's first thing, it is a subjective score, so there is subjective difference. And the second thing, it can be the result can be differed by different factors like gestational age or maternal medication. So this is all about APGAR score. Hope you guys like the video. Do subscribe and share, and bye bye, take care.